Avoid loud sounds like crackers. Say you go to a DJ, in marriages, the speaker sounds, anything which is above 60-70 decibels can potentially harm your ear. Secondly, certain drugs. There are drugs which are called ototoxic drugs, meaning they can harm the ear. In case you all have an existing hearing loss, you must tell your doctor if he's giving you medicines for any other thing, because there are some drugs, common drugs like aminoglycosides, diuretics, and others which can potentially cause a hearing loss. Appreciate that hearing also reduces with age. Like your vision, after the age of 50, there will be some hearing loss. Normally it is gradual, but in case you have difficulty in listening, especially when multiple people are talking or in a noisy environment, this is the beginning of a nerve hearing loss, and you should get your hearing tested. And in case it is, say, more than a particular threshold loss, then certain hearing aids may help you, and you should seek medical advice. And periodically, if you have started having hearing loss, periodically you must get your hearing tested. There are certain situations where you have an ear discharge with hearing loss. In case you have ear discharge with hearing loss, you need to see an ear, nose and throat surgeon who will see your eardrum, examine it with an instrument called otoscope. You may have a hole in the drum, or you may have a slightly more aggressive disease called cholesteatoma, which needs surgical addressing. And if you say a tympanoplasty or ear surgery is done, your hearing loss may be restored. So we must be conscious that hearing loss sometimes can occur even with other symptoms like, say, vertigo, dizziness, and ringing in the ear, tinnitus. So if such a thing occurs, we must do a proper examination, and also sometimes a brain MRI to rule out anything in the brain which is causing these symptoms. Now, ringing is another very common sign which occurs with hearing loss. In common words, it is called tinnitus. So wherever ringing is there, we need to rule out a cause, but sometimes it just occurs without any known cause. So patient is to be reassured. He has to avoid silent environments. Some drugs can help him empirically, and if patient stops thinking about it, sometimes it is self-limiting. Some children, they have a nerve loss which may be congenital from birth or may have developed later on. In case it is there, we must get it diagnosed early so that these children can be rehabilitated. Many of them have bilateral profound loss, means both ears there is no hearing. So this can only be picked up by a test called brain evoked response audiometry, or ASSR. And suppose you diagnose a profound loss, then today we have a very good technology tool called cochlear implants, which they bypass the hair cells and directly stimulate the nerve. And these children who till about 2 decades were doomed to deaf and dumb schools can be rehabilitated after doing this cochlear implant surgery, and after that they can be given therapy which is called auditory verbal therapy, and this is a highly successful operation and which has a success rate of as high as 95%, and many of them have mingled with the normal children, go to normal schools. Hearing is a very important faculty which everyone has. We must learn to look after our hearing, and in case a problem occurs, be it hearing loss or associated symptoms like discharge, dizziness, tinnitus, we must seek correct medical advice, get a proper examination and some tests done, and there are correctable causes of hearing loss with or without other symptoms. And especially if your child you feel is not responding adequately, get him tested, get him diagnosed early, and that is how we can help them. Thank you.